Thank you, Chairwoman DeGette. The COVID-19 pandemic has been one of our nation's most challenging periods. This committee has worked tirelessly to ensure that the nation has the resources necessary to combat the pandemic, and I wanted to also thank Chair DeGette for her continued subcommittee's laser focus on efforts to end the pandemic. Helping Americans navigate safely through this public health crisis has been at the heart of these efforts, and today we continue that focus by examining the ways the pandemic is affecting our children. And as kids across the country head back to school, communities and families are now struggling with the Delta variant, a far more infectious version of the virus. Experts refer to the current wave of infections as, and I quote, as a pandemic of the unvaccinated. And yet, while safe and effective vaccines are available to American adults and adolescents, children under the age of 12 are not yet eligible for these vaccines. As the more contagious Delta variant continues to spread, the number of children with COVID-19 continues to climb. Pediatric units around the nation, but particularly in states with low vaccination rates, are seeing a surge in hospitalizations. And this is understandably concerning to parents who just want to keep their children safe. Now, it's on all of us to do everything that we can to keep these kids safe. We all have a part to play in getting a vaccinated, practicing safety precautions and looking out for one another. Critically, it's important that government leaders follow the science so that we keep our children safe. And state and local actions that ignore or even contradict the science put our children at risk and undermine our ability to end the pandemic. It's also important to understand that children are experiencing this pandemic differently than adults. Difficult choices are often made for them by parents, caregivers, and teachers. And more than ever before, children and their families are being forced to balance numerous complicated risks. The mental health of our children in particular is of great concern. There were already challenges in addressing the mental health needs of children before the pandemic, but those have been exacerbated by increased social isolation, missed milestones such as graduations, and sick or lost family members, friends, or caregivers. So we have to continue to find ways to address the mental health needs of our kids so that they not only survive through the pandemic, but thrive once it's over. So this committee, Congress, and the Biden administration have taken important steps in providing schools, healthcare institutions, and families with much-needed resources. Earlier this year, Congress passed the American Rescue Plan, which provided funding for the safe operation of schools and expansion of pediatric mental health care. And just last week, this committee passed the Build Back Better Act, which, among other critical public health provisions, includes a permanent extension of the Children's Health Insurance Program, or CHIP, and investments in children's mental health programs. The Biden administration has taken bold action to support the safe reopening of schools. This includes significant efforts to increase the vaccination rate of adults and children over 12, which can build a blanket of protection for the children around them. I'm also encouraged by reports that at least one vaccine manufacturer may be submitting an application for a COVID-19 vaccine for children very soon, and the FDA has said it intends to act on that application when it comes within a matter of weeks. And the Centers for Disease Control and Prevention has issued critical guidance throughout the pandemic, including guidance for healthcare providers, community and business leaders, and recent guidance for educators and school administrators. So it will continue to take all of us working together to keep our children safe. I thank our witnesses for joining us today to share their expertise and perspectives on what more we can do to protect America's children. And together we have to navigate the challenges of providing for safety of the nation's children and do everything in our power to ensure health and promising futures. I just want to thank Chair DeGette again for another important hearing with your O&I subcommittee. I do think this is really important. Thank you, Diana. I yield back.
I thank